Hi there folks, this is Matt Scalise, Doctor of Physical Therapy, McKenzie Spine Rehab Specialist, and Orthopedic Certified Specialist. The purpose of this video is to give you alternatives to flexing the low back during your daily tasks. When you repeatedly round the low back during your day-to-day activities, you expose the spine to unsafe levels of stress, you increase the likelihood of sustaining a low back injury, and you delay recovery if already in the midst of having low back troubles. So let's demonstrate and talk about the lifting strategy called the golfer's lift. So the golfer's lift is a great strategy to lift an object that is in front of you and is fairly light, somewhere between 15 pounds or less. It's a great option to utilize when you're reaching into a dishwasher, reaching across a table, across a cabinet, or if you're rummaging through the refrigerator. So let's talk more specifically about the golfer's lift. So with the golfer's lift, find something to support your arm with. You reach forward with the other arm and the back leg, the trail leg, comes up off the ground. It's important that the trail leg comes off the ground in equal amounts of the upper body going forward. So if you go forward 45 degrees, the leg has to come off the ground 45 degrees. If you go further with your upper body, the leg has to counter and come off even further. A common mistake that people make is they tend to round their low backs first and then allow the low back to come up. You really should be done simultaneously. As soon as your upper body comes forward, you want the leg to come up behind you. And there's no problem with bending that planted leg if need be. So if what you're reaching for is a little bit lower and you need to bend that leg down, that's okay. Likewise, if you need to bend that trail leg behind you because you're in a tight corner, that's okay as well. The important thing is back leg or trail leg comes off the ground at the same time as upper body goes forward. For the most part, we always tell our patients whatever arm you retrieve an object with, that opposite leg comes off the ground. So right arm forward, left leg off the ground. There are exceptions, and that exception involves when a particular leg is painful, as in the case of sciatica. So if the left leg, for instance, is very painful, that left leg needs to come off the ground regardless of what arm you're reaching forward with. So if it's the right arm, the left leg comes up. If it's the left arm that you need to reach forward, the left leg needs to come up behind you as well. So once again, the name of the strategy is the golfer's lift. This is Matt Scalise, Doctor of Physical Therapy, speaking on behalf of the Global Exercise Group.